So the microsleeve surgery is my evolution of the popular laparoscopic sleeve gastrectomy, an already proven safe and effective weight loss tool. So the purpose of the microsleeve was to take that operation and lessen the amount of downtime, minimize the amount of discomfort. These laparoscopic procedures have less discomfort than traditional surgery, but there still is some time required to heal and get over those procedures, and that's really based on the amount of cutting, the amount of incisions that are done. We know that there's minimal discomfort that we can identify on the inside related to the stomach and various organs. The discomfort that we really feel with healing is associated with the small cuts that are made in laparoscopic surgery. So let me take you through what has kind of been done with this laparoscopic sleeve gastrectomy and where I have evolved to the micro sleeve approach. I've placed a couple of illustrations here just to show the anatomy. And when we take a look at our traditional laparoscopic weight loss surgery approach, we're going to see small ports, what we call sleeves or ports, which are placed within very small incisions. These incisions will be anywhere from 5 millimeters up to 10, 12 millimeters in width to accommodate a sleeve, if you will. So the purpose of this sleeve, like this marker here, is to go through the abdominal wall. That will allow surgical instruments to go in and out without having to reintroduce an incision each time. So the sleeve stays in the abdominal wall and the working instruments go in and out of it. So traditional laparoscopic sleeve gastrectomy would have a sleeve placed over here in this area. There would be one here. There would be one here, and then one up here, and then one very close to the belly button. And I'll explain what these sleeves were for. And then there would oftentimes be, these are 5, there would be a 6th one placed right up here. This one here would be to lift and retract the liver out of the way of the stomach for better visualization. So these 2 ports here would be for the 2 working hands of a surgeon. And these 2 ports here would be for the 2 working hands of an assistant surgeon. And this port here most often would be for a dedicated camera operator. So the fiber optic camera that visualizes everything on the inside that's on a tube would be placed here, and then you would have 2 hands on each side. And then this would be a stationary port which would lift the liver out of the way. So as instrumentation improved, as technique improved, after we had done thousands of operations, I was able to evolve to where gradually ports would be eliminated. They just weren't necessary. And also the improvement of the camera, the fiber optics became very clear, very beautiful, just like the new TV sets that you see with very high resolution. So things like this port right here would be eliminated, and this port would be eliminated here, and then with the angled camera that's high resolution, a lot of times didn't need to lift the liver out of the way, and this port would be eliminated. So there was a procedure that was developed several years back that said, let's take a large button cushion, if you will, that's a fairly large cushion, and put multiple ports in one location. And we can put that at the belly button. So we're going to take this big cushion here and put 4 of these ports in one spot. That procedure became known as the Sills Operation, and that stands for a single incision laparoscopic surgery. Now, this would eliminate these various cuts in multiple locations, but what we found with the Sills approach is that it required considerably larger incision than what we were used to in standard laparoscopic surgery with these small millimeter cuts. So with this larger incision, there was going to be more discomfort right there at that one incision than what we wanted, and oftentimes we saw problems like hernias and things of that nature that could develop with a larger cut. So this wasn't quite as popular as using the small little cuts. what I have done is I have taken some of both, and I've tried to keep the incision very small, but yet minimize the amount of cutting, and that's what the micro sleeve is. So let me use this illustration here to show you my micro sleeve approach. So what I've done is taken one small cut inside the belly button here, where I can place two ports side by side, two of the small ports side by side, all within one little cut. This is not a button or cushion, these are just two ports that are literally sitting side by side. And these two ports will allow for my two hands to work side by side, much the way that you would say use the controls on a video game. And then up here under this rib cage is a 5mm incision, which allows for a small fiber optic camera, and there's a camera operator over here that uses this small little port to visualize the entire area of the stomach. So through these two small ports, I'm able to perform the same laparoscopic sleeve gastrectomy with a minimal amount of cutting and a minimal amount of discomfort. This evolution has occurred because of the amount of procedures we've done and the comfort level of using the same people and advancements in the instrumentation. We have instruments now that can articulate, they're very precise, they can move around, and they do not create problems using hands side by side. So I'm able to do this procedure using just the two small cuts, which is going to minimize the amount of discomfort, it's going to improve the ability to get back on our feet and get over these operations quickly, all the while giving the exact same safe, effective results of the sleeve gastrectomy.